Everyone. We are here today. This is PEBB, and we're going to talk about flexible spending accounts and commuter accounts. We'll give it just a minute or so, and we'll let people join. I can see the numbers kind of going up, but when I see that it stops, we will just start with the presentation. So we were just talking before the webinar started about our puppy dogs and how much we love them and the names that we have for them. And I said, I'm going to ask everybody to drop their puppy dog names in the question area if you want to. I have a puppy dog by the name of Napoleon, and we call him Napoleon, we call him Popo, we call him Napopo, and we call him Mugsley. So he goes by lots of different names, but I know that we love our puppy dogs. So it has nothing to do with FSAs. Sorry, guys. All right, I'm going to go ahead and start. My name is Linda Fries. I'm the benefits manager for Public Employee Benefit Board. We are talking about FSAs today and commuter accounts. It is open enrollment, so welcome everyone. Webinar tips. If you're not hearing the webinar, go to the audio tab and go to webinar, select your preferred speaker and microphone. To ask questions or to drop your puppy dog names, you can go to the question area and you can ask questions there. They only go to our team here at PEBB. Not everyone that's in the webinar sees your questions, and then we respond to you privately. You'll receive a follow-up email when the recording is available. So everyone that has registered for this webinar, regardless of whether they attend or not, will receive a follow-up email with the recording. And then obviously for additional benefit information, you can go to our website at www.pebinfo.com. All right, Sarah. So the agenda is to talk about flexible spending accounts or FSAs, commuter benefit accounts, ASI flex correction time period, and then customer service contacts. So what is an FSA? FSAs are regulated by the IRS. So PEBB we have our own Oregon administrative rules, and we do have a few rules on FSAs, but the majority of our rules come from the IRS. So when people ask us, oh, why can't you do this? You're PEBB, you should be able to make this correction. I have to say, and Rhonda and Anai and April, our staff here has to say we can't do it because we're regulated. These accounts are regulated by the Internal Revenue Service. It is an annual account. It is taken out of your paycheck pre-tax for eligible expenses. For the healthcare and dependent care FSA, you have to actively re-enroll in it every year. So right now it's open enrollment, October 1st through October 31st. Even though you have an FSA right now, because we're in the last couple of months of the 2025 plan year, you have to actively do open enrollment and you have to actively re-enroll in the FSA this month to have it effective January 1st. You pay for current year's eligible expenses with your FSA, and these accounts are use it or lose it. So the funds do not roll over at the end of the plan year. You have to, so if you put $2,000 in the account, you have to use that $2,000 for that plan year or you will lose it. And they are administered by ASI Flex. They're our vendor that does our FSAs and commuter benefits. All right, Sarah. Flexible spending accounts. You have to enroll annually. The elections last the full plan year unless you have a qualified status change. So I've seen people in the past that have said, you know, I'm going to plan on having a baby for 2026. So I'm going to put, the max into my healthcare FSA because I'm planning on getting pregnant. And then something happens in January or February and plans change. They decide not to get pregnant for the plan year. And they get a hold of us at PEBB and they're like, well, my medical expenses have now changed for 2026. I want to lower my FSA. Well, we can't do that. We can't do that without a qualified status change, like a marriage or a divorce or a birth, or a death. So those would be some qualified status changes that would allow us to alter those accounts. Other than that, we cannot alter those accounts. You don't have to be covered under PEBB health insurance, so you don't have to be covered under our medical, dental, or vision insurance to have an FSA. You can access the full healthcare FSA anytime during the year. So if you decide for 2026 to put $3,000 into your FSA, your healthcare FSA, effective the month of January, as long as you're making that contribution, you'll have access to the full $3,000 January, February, March, until that amount of money runs out. Expenses can be for your spouse and your dependent children, your eligible dependent children. Healthcare FSAs are not for domestic partners, so you can't use the account for your DP, and that again is an IRS rule. We do have a grace period that extends for 2.5 months to March 15th. And the way that works is you have to make contributions through December 31st to get that 2.5 month extension. And then all claims are due to ASI Flex no later than March 31st every year. And so PEBB also does this 2.5 month grace period rather than allowing a rollover. So you have the option when you decide to offer an FSA that you either do a rollover or you allow the 2.5 month grace period. And our board has decided to allow the grace period. And this is the way that it has been for well over a decade with the PEBB plans. All right, thanks, Sarah. Okay, we offer 2 types of flexible spending accounts. So listen up, everybody, because everybody kind of seems to get this confused. We offer a healthcare FSA and we offer a dependent care FSA. 2 totally separate types of FSAs. Healthcare FSA is for your healthcare related expenses for you, your spouse, and your dependent children. So if you have to go get glasses, you would use the healthcare FSA to get reimbursed for your glasses. If you have to go to the dentist and the kids need braces, you would use the healthcare FSA for that expense. If your wife has to go to the doctor or your husband has to go to the doctor, you would use the healthcare FSA for those types of expenses. Okay, it covers your deductibles, your copay, your office visits, your tests, your supplies. So, dental work, vision appointments, your frames, your contact lenses, so things like that. You can find a full list of eligible expenses at the ASI Flex site. So that's the healthcare FSA. Again, it covers you, your spouse, and your eligible dependent kids. The dependent care FSA is for daycare. It has nothing to do with healthcare costs whatsoever. It covers your eligible dependent daycare expenses. It includes child care for children up to age 13, and it is also available for some dependent elder care. It covers daycare while you are at work. So it's daycare, after school care, preschool expenses. It's not to send your kids to cheerleading camp or overnight camps or anything like that. We get asked that every year. You can find, again, a full list of expenses at the ASI Flex account about what they will cover. All right, next slide. So FSAs, how do they work? So we've got 4 steps here. You need to estimate your expenses for the upcoming plan year. Like if you know every month I have to go pick up certain prescriptions and they cost this amount of money, then that's something that you're going to factor in. If you know that you do have, a pretty concrete surgery or something coming up for the upcoming plan year, you might want to factor that in. But you want to be more conservative than liberal when it comes to estimating how much money to put in the account, because you can't decrease it. And again, it's use it or lose it. So being a little bit more conservative is better than being liberal with this account. You will make pre-tax contributions via your paycheck throughout the entire year. You will incur the eligible expenses, and as you incur the expenses, you would submit those claims to ASI Flex, and then you get reimbursed for them. So I love ASI Flex. I have the app on my phone, so if I get a bill in, I just get into my ASI Flex app, I take a picture of it, I fill out a few boxes of information and I submit it, and within a couple of weeks I get a check in the mail from ASI Flex. So that's really nice. Okay, next slide. Annual enrollment is required, so you have to enroll for ASI Flex for the 2026 year this month during open enrollment. So you must complete open enrollment to newly enroll or re-enroll or continue your enrollment in the healthcare or dependent care FSA. FSA enrollments to the next plan year do not carry over. So if you're currently enrolled in an FSA right now, it will not carry over. It will not roll over to the 2026 plan year. You have to actively enroll in that. If you do not do open enrollment this month, you will not be allowed to enroll in a healthcare or dependent care FSA. So make sure that you do open enrollment. I think we've talked about that, I hope enough. Okay, next slide. Okay, so healthcare FSA, the annual maximum, it's going up to $3,300 per year per subscriber. So that's the healthcare FSA, and that's the $3,300 for your family. So plan for predictable recurring expenses. Review your past year as a guide. Be conservative. Please be conservative, because elections are final once the plan year starts. Once January 1st starts, that figure that you have selected is locked in. There's a couple of tools where you can do an expense estimator, and then over-the-counter products that are covered. You do get a grace period. So if you decide to put $3,000 or $3,300 into your 2026 healthcare FSA, and you make a contribution all the way through December 31st of 2026, you will get a grace period until March 15th of 2027 if you haven't used up the whole $3,300. So you'll get January, February, March, 2.5 months where you can submit those claims also to kind of eat up that $3,300. Okay, next slide. Eligible expenses, I'm going to go straight to the middle. Vision exams, eyeglasses, prescription sunglasses, contact lenses, solutions, reading glasses, LASIK surgery, over-the-counter stuff, Band-Aids, sunscreens, braces, first aid supplies, pill holders, blood pressure monitors, thermometers, diabetic supplies, your prescription and office visit copays, your deductibles, your x-rays and your labs, hospital visits, mileage to and from healthcare providers, dental exams, x-rays, fillings, orthodontia, crowns and bridges, dentures and adhesives, guards and implants, hearing exams, hearing aids, hearing aid batteries. So these are just some of the expenses that are covered. But these are the things that feed into your healthcare FSA. Again, this is for you, your spouse, and your eligible dependent kids. Okay, healthcare FSA and eligible expenses. Services not provided yet, so pre-treatment estimates, cosmetic treatments or medications, illegal operations, expenses paid by insurance. So if insurance has covered it, then you don't want to submit it to ASI Flex. Diapers, maternity clothes, insurance premiums, dancing and swim lessons, holistic treatments, natural remedies, vitamins, warranties, healthcare services for your domestic partner. So one thing that I will say is I work with a naturopath and she does prescribe supplements to me, and I do get those covered because my naturopath has prescribed them to me. So that, you know, if that's something that is of interest to you, then work with ASI Flex and your naturopath on those. And she has to write a letter out for me every year itemizing these supplements that she has prescribed to me. So just FYI there. All right, next slide. Healthcare FSA, using your FSA and Garner. So we have Garner, which is new this year. If you're enrolling in a Providence or MODA plan and you plan to use Garner, keep in mind you cannot double dip. You can't get reimbursed for the same medical expense because Garner's only medical. You can't let Garner reimburse for a medical expense and then turn that same expense into ASI Flex because that would be double dipping, and the IRS does not allow this. So we're all subscribers. We're all going to have to kind of monitor that, and Garner's technically considered a health. Whoops, let's go back there, Sarah. It's considered a health reimbursement arrangement or an HRA. You probably should use the Garner account first and use up that money and then start dipping into your ASI Flex healthcare FSA. But you also need to keep that in mind when trying to figure out how much money you want to set aside for Garner or for ASI Flex. You also want to get into Garner and find out how many of your doctors are actually participating as a top provider. I only have a couple that are participating, so some of the other doctors that I see or that my husband sees are not listed, so we wouldn't get reimbursed for them, so we would use the ASI Flex for those. So it's a little bit of management on our part as subscribers to see what we're going to turn in with Garner versus what we're going to turn in for ASI Flex. Okay, next slide. When you receive care from a Garner top provider, approved provider, Garner's going to, so I don't know how many, and I don't want this webinar to be about Garner or whatever, but I've downloaded the Garner app. I've looked up the doctors that my husband sees or that I see, and I've loaded them into my care. So when we start to see them next year, those expenses will get reimbursed. But I have other doctors that we both see that are not in the Garner app, so I would start to turn those into ASI Flex. But the ones that I'm getting reimbursed with Garner, I'm going to let Garner reimburse me first until I use up all of my funds from Garner, and then I would start to use ASI Flex for those top providers because I've used up all of my funds from Garner. So it's a great benefit, but we just have to, as subscribers, we're going to have to monitor it. All right, let's pause and let's look at questions. April, Rhonda, what are the questions coming in? I imagine there's a lot.
Linda, this is April. Do you want to, just for the folks who maybe haven't heard about Garner or don't know what it is, you just want to give maybe an overview?
Yeah, so Garner is basically, it's an added perk for Providence and MODA this year. And you can go on your phone and you can look up the Garner app and you can download it and you can pick, I think you pick PEBB as the employer, and then you can start to look up some of your doctors. For example, and this is totally an example, you know, Dr. Smith is your primary doctor and you live in Salem, and you look up Dr. Smith and Gardner's like, great, he's a top provider. You can add him to your care in the Gardner app. And then when you go to see Dr. Smith, because you get strep throat in January of 2026, Garner's going to say, well, gosh, Linda Fries has Dr. Smith added as her care team under the Gardner app. She just went and had a throat culture because of strep throat, and then she had to go to the pharmacy and she had to pick up, you know, amoxicillin for that. They're going to reimburse me for that. And April, what's the amount that we get reimbursed for? Do you remember? Or Sarah?
Yes, it is $1,000 per year for individual coverage and $2,000 per year if you cover yourself and your family members.
Okay, so basically I can go see Dr. Smith, you know, all year long, and if it's just me on the plan, then Garner's going to reimburse up to $1,000 for Dr. Smith. If I also have my husband on the plan and he sees Dr. Jones and I've added Dr. Jones to my care under my account, then when my husband Dean goes and sees Dr. Jones, we'll get reimbursed for that. So again, this is an extra benefit that's added to our Providence and MODA accounts this year, but we, as the subscribers, are going to have to monitor that money coming in where we're getting reimbursed versus the claims that we're submitting to ASI Flex. So I hope that explains what Garner is. Any other questions? Everybody's being quiet. Does that mean no questions? All right, let's move on to the next slide. So we're going to shift directions here and we're going to talk about the dependent care FSA. Again, this is for daycare expenses, not healthcare expenses, but daycare expenses, mainly for your eligible children under the age of 13. The annual maximum has gone up considerably. It is $7,500 per year per family. So let me emphasize, this is per family. So if you are a PEBB member and your spouse works for Cold Stone Creamery, and Cold Stone Creamery also offers a dependent care FSA, the max that you all can put in as an entire family is $7,500. So if you're putting $3,500 in right now, then your spouse can only put in, what is it, $4,000, because you can't go over the $7,500 per year family limit, or it's $3,750 per year if married and filing a separate income tax return. And you can find a full list of dependent care expenses at the ASI Flex account. And now I want ice cream because I said Cold Stone Creamery. I haven't been there for a while. Dependent care FSAs. they also are use it or lose it. The funds do not roll over. So you have to plan accordingly with the dependent care FSA. Okay, next slide. Eligible expenses, babysitting while you're at work, preschool or nursery school for young children, before or after school care, day camps. It's for children under age 13. And it's for child age 13 plus or adult if not capable of self-care. And if you have any children or adults that fall into that category, I would really consult with ASI Flex before just putting money in this account and assuming that it would be covered. So that would be, we don't have a lot of people that do it for 13 plus or adults. So that would be something that I would really check out first before I would assume that things are covered. All right, next slide. So ineligible expenses, services not yet provided, educational or tuition expenses, kindergarten or higher education costs, so private school would not be there and be available, overnight camp expenses, services during vacation, holidays, or leave of absence. So if you're going on a cruise and they have, you know, a little camp for the kids so that you can put them over there and it costs $500 while you're on the cruise to do that, it's not covered. So sorry about that. Only custodial parent expenses are eligible in a divorce situation, so only the custodial parent. And expenses exceeding $7,500 per year. Eligible FSA expenses, again, you can find a full list at the ASI Flex site. All right. So some helpful tips. We have really discovered these over the years. Start the dependent care FSA when you're ready to begin child care, okay? When you're ready to start daycare. We have a lot of people that are going through open enrollment right now, and they or their spouse are pregnant, and they're like, baby is due in January or February, and we know that we plan on working after baby is born, and we're going to put baby in daycare. Well, baby is not born yet. And a lot of people change their minds once the baby is born, and they're like, oh, so-and-so is now going to stay home from work. So this is our advice to you. Don't let us know that you want to start a dependent care FSA until you're actually ready to start daycare. Because if you make the action during this open enrollment and the plan year starts and baby's born in February, and then come April, you're like, yeah, we've decided not to use daycare. You know, Julie's going to stay home with the baby. We will not cancel the dependent care FSA for you because there's no qualifying event. So don't start it until you're ready to use it. Another huge issue with dependent care FSAs, you have to notify us within 30 days of a tuition change, okay? Tuition, the cost of daycare change, I guess I should call it. You know, if the daycare cost is going way up in the summertime because the kids are there full time, you might want to let us know in May, hey, my daycare costs are going up, so I want to do a qualifying event to increase my dependent care FSA. And then in September, my daycare costs are going way down. So in September or late August, I want to do another qualifying event to lower my dependent care FSA. If you notify us beyond the 30 days, you do not have a qualifying event. We will tell you, no, we cannot alter the account. So being very timely about that is very important. Submit the claims promptly to avoid losing any funds. I will tell you this, I have seen people put the maximum into the dependent care FSA and they have forgotten to file any claims for the entire plan year, and they've lost the whole bank of money in their dependent care FSA for the entire year. I'm talking $4,000 or $5,000. So please, submit your claims for both the dependent care and the healthcare FSA. A lot of people like to save them up to the end of the plan year. I do not. I'm submitting my claims every time one comes in. So submit them timely. Dependent care FSAs cannot be used for healthcare expenses for your kids. And so that's another huge mistake that people make about the dependent care FSA. Okay, next slide. Important dates about the FSAs. The claims must be incurred between January 1st and March 15th of the following plan year, or during your coverage period. Incurred means the service was received or the product secured regardless of payment timing. The claim submission deadline is August 31st of every year. So August 31st of 2026 will be the claim deadline for plan year 2025 that we're in right now. And submit early to avoid missing the deadline. And the only way you get the grace period is if you have submitted through December 31st for your healthcare FSA. All right, next slide. We're going to pause before we start commuter accounts. Any questions coming in? All right, it must mean that everybody's getting answers to their questions. That's wonderful. Commuter benefits. So we're moving on to the commuter benefit accounts. These are different. They are also administered by ASI Flex. They are IRS regulated. They're a little bit more forgiving though than your healthcare or dependent care FSA. You can enroll, change your amount, or cancel these accounts at any time. So you don't need a qualified status change to alter these accounts. Your election is month to month. You make pre-tax contributions through payroll deductions. You pay for current month commuting expenses. So you would submit claims for parking or transit expenses incurred during your coverage period. Reimbursements are capped at the IRS monthly limit, and unused funds. So if you cancel the account, I mean, these are more forgiving accounts, and you can cancel this account at any time. But once you cancel the account, the 6-month clock starts to tick. And if you haven't basically used all of your funds or turned in claims for those funds, 6 months from canceling, you lose all the money in the account. So just kind of goes there again, use it or lose it basically. Okay, next slide. There's 2 types of commuter accounts that PEBB offers. We offer a parking account and a transit account. The parking reimbursement account, it pays for your parking at your place of employment, or parking at a non-state owned location from which you commute to work. For example, you take the bus to work but you have to pay to park at the bus lot, to take the bus into town. It would cover the parking at that bus lot. Here's where people get confused about the parking account. If you park at a state-owned lot or garage, you don't qualify for the parking account. And you don't qualify for the parking account because payroll's already taking money out of your check pre-tax to pay for your parking. And I think some universities are like that also. So check your paycheck, talk with your payroll, and make sure that, okay, I'm not parking in a state-owned lot, or I'm not parking in a university lot where they're already taking the money out of my paycheck. When we were working in the office in downtown Salem, a lot of us parked over at the Lee Apartments. It was not a state-owned lot. It was a privately owned parking lot. And so that would have been eligible for the parking account because it's not coming out of my paycheck. So that's just kind of an example. And a lot of people do get this confused. All right, next slide. The transit or the van pool reimbursement account, it's commuting expenses to get to work. So bus, rail, ferry, van pool expenses that you incur commuting to and from work. It does not include maintenance on your car. It does not include fuel. It does not include your bicycle. It does not include rain gear for riding your bike or a headlamp for riding your bike in the dark. So just answering questions before they get asked. So it does say bicycles are not included. All right, next slide. Parking reimbursement accounts. So $325 is the maximum per month that you can put in. So again, it's for non-state owned parking lots. And if you work for a university, please check with them also. You can use it for parking meter expenses at or near your place of employment, parking garage expenses at or near your place of employment, parking at a place from which you commute via mass transit. And again, the $325 maximum per month, you can put in as little as, I think, $25 per month. $325 is just the max that you can put in. Okay, next slide. The transit van pool is also set at $325 per month. And again, this is transit to get you to and from work. Train, buses, subway, ferry, streetcar, van pool subject to IRS guidelines. Again, you cannot use it for your own personal vehicle or bicycles. They are not included. All right, next slide. Ineligible expenses, non-work related parking or transit costs, parking at a state-owned lot or a university-owned lot where it's already coming out of your paycheck, bicycles or repairs, ride share. We've had this, can I use it for Uber or Lyft? No, you cannot. Gas, fuel, or vehicle repairs for your own personal vehicle. All right, next slide. The IRS requires you to certify that expenses are eligible and not reimbursed elsewhere. You may be asked to provide third-party documentation or explain if it's unavailable. For example, if you're using a street meter, you might have to list kind of like a legend of, you know, the dates and where you parked, what you parked for, and how much you paid. Maybe even with receipts, like if you put your debit or your credit card in there. and submit a claim form. It's required for manual submissions. All right, next slide. Important dates. Again, March 31st is the magic date for getting all claims in for the previous plan year. So even though it might run out for 6 months, March 31st is the deadline to get in 2025 expenses. March 31st, 2027 will be the deadline to get claims in for 2026. Inactive accounts, no activity for 180 days. So you've canceled the account. Maybe you get in this open enrollment and you see that you're currently enrolled in one of these and you cancel it. So it cancels effective December 31st. If there is no activity in this account for 180 days, all the balances in these accounts will forfeit and you will lose the money. University members only when enrolling online, be sure that you select the correct number of months. So basically, how many paychecks do you get paid per year? 9, 10, 11, or 12? If you're not sure, check with your payroll to find out, because we have to reconcile these after open enrollment. And it's usually a ginormous report because the number of months that you put in doesn't match what your payroll is saying. So if you're not sure, don't guess. Maybe you just shoot an email off to your payroll and ask them, how many paychecks do I get? Or if you have a payroll system where you can get in and look, that would be very much appreciated. And again, if you do make errors, sometimes we don't figure those out until a little bit later, and those could impact your balance and your contributions and your ability to also use those accounts. So just be watchful of that. All right, next slide. Okay, corrections. Before we get to corrections, let's pause. Let's see if there's any questions coming in that haven't been answered. Man, you guys are great. All right, we will move on then with the correction timeline. So before January 1st of 2026, if you've enrolled in a healthcare or dependent care FSA during this month, and you need to change it, you're like, oh my gosh, I mean, I'm going to have surgery in January, so I need to increase my healthcare FSA. Those changes need to be in no later than December 31st of this year. Getting pregnant in the new plan year, or knowing that you're going to have, just getting notified in January that you're going to have surgery, those are not qualifying events to increase your dependent care or decrease it or anything. Any updates that you do during the correction time period will become effective January 1st, 2026. If you do not enroll during this month, during open enrollment, you do not get to sign up for a flexible spending account. Make sure that you understand your choices, whether you're really enrolling in a dependent care FSA or a healthcare FSA, how much money you're putting into them, is it the correct amount? Because you do need to make changes by December 31st. We will not make changes to those accounts after January 1st. All right, next slide. As of January 1st, 2026, all ASI Flex issues come to PEBB as an appeal. No healthcare or dependent care FSA cancellations are allowed or changes unless you experience a qualified status change, like a marriage, a divorce, a birth, a death, things that would allow a change in those accounts. No retroactive FSA corrections or enrollments, so you may lose money. No mid-year enrollments or prospective increases or decreases without a qualified status change that allows you to do so. The only thing PEBB will do is adjust the number of months prospectively if you enroll with a mid-year with a qualified status change, or we'll adjust the number of months for the university members. So if you put down the wrong number of months and we have to correct that and correct your contribution, we'll do that for the university members. But really for the PEBB agencies, once the plan year starts, you are locked in with those accounts. All right, next slide. After open enrollment, we started doing this several years ago, and I think that it works pretty well. You're going to receive an email from PEBB, and you're also going to receive a letter in the mail, a United States Postal Service mailing. So it's an envelope that you get to open up if you've enrolled in a healthcare or dependent care FSA or a parking or transit account. And the healthcare letters will be blue, the dependent care letters will be pink, the parking account orange, and the transportation account green. And it will say, you know, hey, Linda Freeze, you enrolled in this healthcare FSA. You're putting $3,000 a year in. This is what you can use the account for. Are you sure that this is what you wanted? So we do that for each letter. You know, hey, Linda Freeze, you enrolled in a dependent care FSA. You cannot use this account for healthcare expenses. Are you sure that you wanted to do this? And here's how you can correct it. So when you get these letters, these hard copy letters from PEBB during the month of November next month, and an email from us, open them up and read them and make sure that, you know, yes, I enrolled in the right account. I put the right amount of money in it. I only put $300 in it. I meant to put $3,000, whatever it is. Verify your enrollments, and we do this on purpose because we know that these accounts are locked once January 1st starts, and so we want you to be alert and to realize these are the accounts I enrolled in. This is the amount that I chose. This is correct or this is incorrect. So if it's incorrect, I need to get a hold of PEBB and I need to get them to fix it before January 1st hits. So do not throw these letters away. Do not trash these emails. Read them, look at them, read the entire letter, read the entire email, not the first line, because it has important information in it. All right, next slide. Well, I just kind of explained. This is the purpose of PEBB sending these letters and emails to you. It's just to really verify you enrolled in the correct account with the correct amount of money. We don't want to see you lose money. We want to see you rewarded from these accounts, that they're very useful for you for the 2026 plan year. And we hate it. We hate it when people are like, oh my gosh, I enrolled in the wrong account and there isn't anything we can do about it once the plan year has started. So just really watch the emails and read them and the letters all the way through. All right, next slide. Customer service, this is the contact information for ASI Flex. So their website, you can get a link that jumps you straight over to ASI Flex from the PEBB state website, which again is www.pebbinfo.com. But you know, you also can just get online and Google ASI Flex and it pops up at the top of a Google search, and you can get online and take a look at their FSA store, or you know, the list of eligible expenses. All right, Next slide. PEB member services, this is our phone number. We're available Monday through Friday, 8 to 5. Our email for our benefits staff and where you can enroll for any of these accounts is at www.pebenroll.com. Forms for ASI Flex are on our state website under forms, but we do want you to enroll online right now. And then the plan info is on our state website. We're going to pause right now. Are there any questions coming in? April, Rhonda, I'm going to take it that there are not any questions.
Linda, I think a lot of the questions are being answered in the chat. One just came in. If you terminate a PEB employment mid-year, does it prorate and reconcile? Sure.
If you cancel, so you have a qualifying event. So let's talk healthcare FSA. I'll use this as an example. Let's say that you start your healthcare FSA January 1st. We see a lot of people that take a leave from work. So maybe the month of June, you are taking a medical leave from work. If you do not contribute, so if you do not work out with your payroll department how to make your June contribution, then you will not be able to submit claims for the month of June. And when you come back to work, you will have to re-enroll for the FSA. If you quit employment, let's say that you quit employment in May, you will only be able to submit claims January, February, March, April, May. You will only be able to submit claims for the months that you made contributions. If you have used up the entire account, maybe you said that you wanted to contribute $3,000 and you used all of that money up in January, and then you quit with the state, and then you came back, and then you were like, I don't want to enroll in the FSA. We will make you enroll in the FSA if you've used up all of your funds, to counteract the $3,000 that you've already used up in the month of January. So we do try to reconcile if the person comes back to work. But I want you to be aware that if you don't make a contribution for a month because you're out on leave, then you don't get to submit claims for that month. So, and a lot of people that take a leave are out on a medical leave. So you want to submit claims while you're out on a medical leave. So you'll have to keep up with your contribution during the time that you're out. So you'll want to work that out with your payroll on how to do that. All right, any other questions coming in?
Linda, this is April. Actually, this just came in and it's a great question. Like if time is running out and I still have money, how do I use up my dollars? And I can answer that one because I do this a lot. I go to ASI, it can link to the FSA store, and you can log in to the FSA store and you can browse everything from over-the-counter medications. I mean, I have kind of stocked up on kind of cold and flu medications. They have tons, I would probably say in the hundreds of products that are available that you can use, you know, that is automatically, it's covered under your FSA. So if you need to use up your benefit dollars, then that's a good way to do it. Also, if you go to Walgreens or Walmart, you can, and you have a debit card, you can use that for anything on the little tag that says like FSA, OTC, or whatever. But yeah, I know those are kind of the things that I think about because it is a use it or lose it, and I don't want to lose it. So that's my that's my 2 cents.
And you're right, April. They have They actually have some really fantastic things out on their FSA store. I have dry eyes, and they have like this little heated mask that goes over your eyes. It's absolutely fabulous, and I was able to use my healthcare FSA dollars to purchase that from their FSA store. Glasses, you know, if you have to use your FSA up and you need reading glasses, if you're over the age of 50 like me, or prescription sunglasses, an extra pair of glasses to keep in the car, you can go pick up a pair of glasses and you can use your FSA for that. First aid kits, those are always awesome, and they make great Christmas gifts also. So lots of ways to use up your money if you need to. So I hope that answers the questions. Anything else? All right, well, if not, we really appreciate our PEB members. We love serving you. It's a joy. We want you to get out and complete open enrollment. So if you haven't done that, please go do your open enrollment. And with that, I will close this webinar. Thank you all so much.